our IGHD Brown seminar. We are very glad to have back our colleague Khudejha Asghar. Khudejha has over a decade of experience researching, preventing, and responding to gender-based violence and violence against children in conflict and post-conflict setting, and in the United States as well. Her work draws from public health, human rights, and social work approaches and centers holistic understanding and action to prevent violence and support survivors. Khudejha has worked with a range of local and international nonprofit and academic organizations on the intersections of gender-based violence, violence against children, and or sexual reproductive health. Khudejha has a BA in International Relations, a Master in Public Health, and a PhD in Public Health. And also she was a colleague as well in IGHD as a visiting lecturer earlier this semester. So we are very happy that you are able to join us, Khudejha. Thank you so much for joining us for this Brown Bag seminar. And as we mentioned in the email, the idea will be that you can present between 30 and 40 minutes, and then we can have around 20 minutes of Q&A towards the end. So thank you so much for coming, Khudejha, and the floor is yours.
Thank you. And just verifying you can still see my screen. All right. Yeah. So it's great to be here. And what I'm going to try to do is go through about a decade of research really quickly. And so yes, and so it's centering around three key questions. So the first one is, how does political violence impact relationships between intimate partner violence and violence against children in their homes? So we'll be looking at a few contexts. So Colombia, DRC, Myanmar, and Ethiopia. So looking at mostly qualitative research and then a little bit of quantitative research. And then we're going to move to South Africa to look at how these impacts continue across generations. So looking about 30 years post-apartheid, what we're finding with parenting, and then looking at how we might stop cycles of violence. So going back to some of the qualitative interviews from Colombia and some of the ideas around how we might be able to interrupt these cycles, alongside some findings from a randomized controlled trial in DRC. And so just to give brief background, there's 123 million people who are forcibly displaced at the end of 2024. And this number has doubled in the last 10 years. And we know that most people are internally displaced, although a lot of attention comes to refugees. And so in this research, we'll be looking both at refugees and people who are internally displaced. But the bulk of people who are displaced essentially are often displaced to neighboring countries. And so just to note that as well, most of this research focuses on contexts of protracted conflict. And so we know that there's been quite a lot of natural disasters or disaster-related displacement, increasingly, especially in the last few years. So just wanting to note that this is specifically looking at contexts that have been marked and defined by conflict over, in most cases, periods of decades. And so when it comes to the impact of political conflict, so what do we know? So outside of conflict contexts, we know that 1 in 3 women experience physical or sexual violence from an intimate partner or non-partner sexual violence in their lifetime. There's been some research looking at Liberia, looking at different communities and comparing conflict-affected communities to non-affected communities that has found 5 years post-conflict that women were 50% more likely to have experienced intimate partner violence in places where there was conflict as compared to places where there wasn't. And so that just notes that regardless of whether or not somebody was living in a context at the time of the conflict, that there may be impacts that go beyond the conflict's end. So when we think of, peace or security, it's not necessarily just that we have a peace deal, but that there's actually a need to intervene years afterwards to ensure rebuilding and stability. And so now looking a little bit just at intimate partner violence and violence against children. So within a 1-year period, 1 in 10 women experience physical or sexual intimate partner violence, and 1 in 2 children, so half the world's children, experience physical, sexual, or emotional violence. So intimate partner violence and violence against children are both thought of as global epidemics that occur even without the presence of political conflict. What we see is that they might be exacerbated in situations of conflict. There isn't a lot of global evidence to date on co-occurrence. Most of it comes from high-income contexts, in which it's seen that about 10 to 30% of families may have co-occurring intimate partner violence and violence against children within the home. But in East Africa, so in DRC, we saw estimates as high as 50% of families. And so why are we looking at these things? So looking specifically at these overlaps in relation to other forms of violence is that there's both shared risk factors and consequences. So there's been some social norms that are theorized around this, and I will present a few results as well on some social norms in relationship to violence. So violent and controlling masculinities, which we also know are associated and often entrenched in times of conflict. Support for gender inequality, which precedes but also can be exacerbated during times of political conflict. Acceptance of violent discipline, so there can be a broader acceptance of use of violence, but then there can also be acceptance of use of violence against women or use of violence against children specifically to correct behavior, and also prioritization of family reputation. So in several regions and in several contexts, it's seen as a mark against the family, for example, if someone's experiencing violence, which can deter help seeking and also then sometimes allows violence to continue without any form of help or intervention. There's also several shared risk factors, and so the research on some of these is a bit mixed, and that's just to say that these three, alcohol use, younger age, and poverty, are thought to be consistently associated, but that a recent systematic review meta-analysis has found some inconsistencies in this evidence. We also know that exposure to both of these forms of violence, either singularly or if one person's experienced both, does have effects on mental health. So we see twice the risk of depression and anxiety, and we also see that cumulative exposure to violence tends to have a dose-response relationship to poorer health. And so these forms of violence are also global priorities. So just thinking about the Sustainable Development Goals is Goal 5.2 seeks to eliminate intimate partner violence, and Goal 16.2.1 seeks specifically to eliminate caregiver-perpetrated abuse against children. And so thinking about, so now we have a little bit of context around political violence, a bit of context around intimate partner violence and violence against children in the home. And so the question is, how does political violence impact relationships between intimate partners and between parents and children in the home? So we looked at both quantitative and qualitative research across a period of years. And so I'm just going to be presenting findings across a number of studies. And so in 2016, 2017, a study looked specifically at Colombia, so two contexts, right outside of Bogota, a neighborhood called Cazuca, which is known for being an informal settlement, and then in Cordoba, in an area called Tierra Alta, which is known for being a bit peri-urban and moving towards rural. So the underlying study looked at several questions, but we'll just be looking at questions 2 and 3 today. So how does exposure to conflict and or relocation affect families? And then later I'll present on the third question. And so just noting what we did was a series of repeat interviews, so working with the same participants over several interviews using photo elicitation. And so we worked with both adults and adolescents, and the inclusion criteria was age 13 and above. And since it was actually a bit stigmatized in the Kazuka area to identify as someone who was displaced due to conflict, we didn't require that somebody disclose that for the purpose of the study, but we worked with community leaders that had good knowledge of areas where there were people who had been recently resettled, who had experienced conflict, and so we used that sort of living in the context rather than acknowledge displacement as the criteria. What we found was most people were displaced, and so what we found was that there was the experience of conflict could shift family systems. So we saw in some cases families coming together, or people who may not have lived together before then ending up together in the place of resettlement or temporary resettlement. But we also saw in some cases families breaking apart, so where there was separation. And there was exposure to armed conflict layered over exposure to intimate partner violence and violence against children. So in many families, these three things were occurring at the same time. We also found that exposure to conflict and relocation, people were often moving towards urban settings, and that there were some unique challenges in these contexts. So a lot of people had been farming their land before, for example, or living in rural areas, and they did not often feel that they had the right skills to obtain employment in urban settings. There was also shifts in terms of their schedules and increased food insecurity. There's also greater risks of work-related illness or injury, and partially due to being in riskier jobs. And there was also community violence in the new context, especially in Kazuka. So people moved from a context of, they moved due to political conflict, but then they were moving to an environment where there were really high levels of day-to-day violence, and that created a lot of stress for families. And alongside that, we found that food insecurity and lack of resources also created stress. So with this quote, I won't read it out loud, but you can read it on the screen. So just to note that an adult man described beating his child because she was hungry and she was expressing that hunger. And so there seems to be a lack of ability to soothe in some cases, and a lot of people's emotional regulation had been quite taxed. So inability as well to, for example, care for oneself. We also saw at times that there might be shifts in divisions of roles. So particularly for women, that they might be taking on new roles and actively seeking employment, whereas before that wasn't necessarily the case. And essentially that they may have cared for the household before while their husband or partner had been working outside the home. So in some way, there could be a shift towards empowerment for women, and some women did, in the context of this conflict, were able to leave a harmful partner. But we also found several cases and where there was a lot of loss of family members and a lot of grief around that. So while some people were able to get out of bad situations, a lot of people they had family members who'd been killed and loved ones who died in the conflict as well. And so just noting, so in Soacha, so in Kazuka, one adult woman noted some of the safety issues and how they created more anxiety for her. And also just that there was a sense of emotional overwhelm and inability to, inability in a way to reestablish and get the emotional safety and security that people need to heal. So it's just to say that people were moving from one context to another in which they were exposed to quite a lot of stressors, and that the level of violence in the neighborhood then precluded people's ability to actually feel a sense of safety and healing. And so we found some similar things and also some different things in DRC at Myanmar. And so in these two contexts, and this was a study so at the IRC, so looking between 2017 to 2019, that was looking specifically on at social norms and other risk factors. And so this study was slightly different than the study before. The study in Colombia, we were asking people about their own experiences, and we were using photo elicitation to essentially have them show us parts of their community and sort of describe things like what made them feel close or not close to their family, or what made them feel safe or unsafe, things like that. But here we were using vignettes. So we had a hypothetical study of a family and described as a man, woman, and then several children living in the home. One child was described to have disabilities, and then there was also an older sister or an elderly sister living in the home who had disabilities. And so it was within this context of this hypothetical family that we then asked questions to understand what perceptions might be of, what perceptions might be of needs, what perceptions might be of different family members based on identity, but also what was the context around the families and the experience of violence. And so from this, we created what we found was most appropriate to describe participants' responses was a socioecological model. And what participants described in both contexts was that the macro level factors, such as armed conflict, combined with age and gendered power hierarchies, resulted resulted in different kinds of factors that operated at different levels of the social ecology to either exacerbate or help mitigate violence. In most cases, these factors were exacerbating violence. And so I think the one exception is religious beliefs, is that in some cases people cited certain religious beliefs as deterrents for using violence, or in terms of pro-social behaviors or found behaviors that would be supportive of family members, regardless of whether or not they had disabilities, for example. In other cases, religious beliefs were used to justify men's position over women, for example, and justify in some cases use of violence for violating that expectation of being differential. And so we found, in contrast to a lot of research on IPV to date, which has really looked just at the experiences of women and girls, because we were looking a bit more intersectionally, we found this intersection of age and gender. So noting that there were hierarchies that were gendered, but also that there were hierarchies based on age. And so with children, for example, it was considered acceptable that parents should be controlling their behavior or guiding them. And with women, then it was seen acceptable oftentimes that men would control or guide them. And so just giving a few quotes around some of those macro level drivers. And so, so just noting for religious beliefs, one person said that the Bible says a man should be the one in charge of the family and he should take good care of his house. So specifically noting what expectations of men were, and also noting that noting a power differential, right, between men and other people in the home. There was also intersections between gender inequality and poverty. So while being able to economically provide for the home, especially in context of economic precarity, was seen as very important and valuable, men who were not economically providing for the family, for example, that didn't necessarily mean that they lost their status of power or influence within the home. And so this quote says, "A man is always a man. Even if you are tired, you shouldn't put yourself higher than your husband, even if you find him acting wrong. He's the head of the family, so he should not allow disorders in his house, even if he doesn't bring anything, for example, financial resources, at home." And the last quote was around armed conflict. And so noting that a result of armed conflict can be disability and often is disability. So people are often injured either directly due to the conflict or because of inability to access medical care for other health reasons. And so we found actually quite high numbers of people who reported having some level of disability in the RCT that I'm going to present later on. And so it was a bit higher than people expect, but also noted that there's been a bit of a gap to date around understanding and action to support people who have disabilities in these contexts. And so in this quote, what the participant was describing was that if a man has a disability and isn't able to work, for example, that then it may affect the whole family because they're relying on him to economically provide. So if he's not able to do particularly physically strenuous jobs, so in the context of Myanmar, a lot of participants who were displaced, for example, a lot of the men had to work in manual labor or day labor jobs because there weren't other job options available. And so if someone had a disability, it would be really difficult for them to engage in that kind of labor, and quite painful actually if they were to do it. So in that context, then there weren't a lot of job options for people who had disabilities, and that would essentially then impoverish the whole family, but also it wasn't always necessarily considered that, for example, a woman might be able to go work, right? And so the gender hierarchy held even in contexts where it would make sense for it to be shifted. And so what we found in particular, looking intersectionally, so specifically looking at women with disabilities, was that there was the gendered expectations of women to care and provide within the home, for example. So to complete household chores, to care for the children, to keep things clean and tidy, like those sorts of traditional expectations, that if women had a disability and were perceived to not be able to fulfill those kinds of gender roles or expectations, that they might be considered to be a burden and they might be treated as such. And so particularly the participants noted risk of emotional abuse against women with disabilities. And we didn't we didn't present this in the paper, but one reflection on this, just given the last few years and increasing research, is also around capitalistic ideals and the ideal of people's value being primarily economic, and what that means, or their value being primarily of a very specific kind of role and what that means. And so in the interviews, for example, it wasn't acknowledged that somebody may have a positive role in the family as social support or providing other forms of care and kindness to family members and things like that. Whereas, we may, if we're thinking from a more feminist ethic, right, or care ethic, that we would consider every person as value. So just noting that, like that precarity, in part because of economic valuation and combined with lack of resources, that it can really put people at risk of different kinds of abuse, but especially people who have more marginalization, such as people who have disabilities. And so that was all qualitative work. And so what I did in my dissertation was actually to then try to look at some of this quantitatively. So looking both at contexts of conflict and also contexts which had not experienced conflict. And so I used the GAGE, the Gender and Adolescence Global Evidence Study, which is a longitudinal cohort study, which now has had several rounds. At this point was 2018, 2019, so it had about 1 to 2 rounds of data collection completed, but looked cross-sectionally at some of the factors across the social ecology that might be associated with co-occurring violence, specifically looking at adolescents aged 10 to 12, so their own self-report of their experiences alongside their female caregiver's self-report of her own experiences. And so just a brief note on the study was most children lived with both parents. So there was 3 regions and 1 administrative city that were included, with representative sampling of families that had an adolescent of this age. There was another study that's been published on this data, had found that 66% of adolescents had experienced different forms of abuse from an adult caregiver within the last year, and that DHS statistics, so national level statistics, find that 34% of women in Ethiopia have experienced intimate partner violence in a 12-month period. And so I'll go through this really quickly, but just to say that we used dyadic data for this. So it was a household survey, and I looked at caregiver and adolescent self-reports, and the outcome was family violence typology. So 4 mutually exclusive categories, where it's co-occurring violence, IPV only, violence against children only, or no violence. And all of the reporting was within the last 12 months in terms of violence exposure. So that was a direct overlap between intimate partner violence and violence against children. And so this is just the model, the analytic model. And I'm going to present just briefly on the outcomes, but just noting that I sought to look at some of the social norms in a bit more detail. So looking at individual level attitudes, looking at community level attitudes, but then also looking at behavioral norms. So behavioral measures that indicated normalization of corporal punishment, for example, was adolescents who had reported witnessing a teacher use violence against a peer in their classroom, or early marriage, so caregivers report of being married before the age of 18. And so there's a range of predictors that I looked at, and I used binary logistic regression. Happy to talk about that in more detail if you want. But just to know, what we found was that the overall prevalence of co-occurring IPV and violence against children was 35%, and that this was much higher in conflict affected as compared to non-conflict affected contexts. And when I say conflict affected, this was cabilets in which there had been political conflict within the past 5 years, as reported by community leaders who'd completed like an assessment of the cabinet for the study. So just note that it's 32% in non-conflict affected areas as compared to 45% in conflict affected. So this is quite similar to the DRC data. And there was a lot more variables that are not shown here, but I just wanted to highlight that looking at co-occurrence, that attitudes that were inequitable towards gender, that were tolerant of violence against children, so belief that children should be punished, were both they were both associated with higher levels of co-occurrence of violence. Caregiver attitudes towards household task sharing, so in terms of attitudes that were supportive of gender equality amongst children, were found to be protective against co-occurring violence. Also found that household economic status was, so higher wealth quintile was protective for co-occurring violence, and that alcohol abuse was increased the risk by nearly 3 times that there would be co-occurring violence. We also found that parenting, or that use of positive parenting strategies, was also protective for co-occurring violence. At the community level, so we didn't see that community level average norms, for example, were not significantly associated with co-occurring violence, but normalization of punishment was. And I also, this is a marginal association, but PSNP is a productive safety net program in Ethiopia, which is a national level program. And so at the community level, if a higher percentage of people were benefiting from that program, there was a marginal association with less co-occurring violence. So just noting some of the structural issues is that there seems to be potential then for economic support at a large scale to have some level of protective effect. And then we found for political conflict exposure, it was between 4 to 5 times higher odds of co-occurring violence, even when adjusting for all the other factors amongst families that experienced violence in the last 5 years, or lived in communities that had experienced violence in the last 5 years. And so how do these impacts continue across generations? I realize it's 30 minutes, and so I'm going to speed through this piece. But this is some research that I've been working on recently, and so it's currently under review, but we wanted to understand the relationship between experiences of parenting during childhood and parenting experiences used in adulthood. And so this was specifically looking at a cohort of adolescents who were aged 10 to 17 about 12 years ago, and then looking at their reports of their own experiences of parenting at that time when they were adolescents, and then now looking at their self-reported use of parenting strategies in adulthood. And so this is a longitudinal study looking at them for a period of about 10 to 12 years, and then looking as well at risk factors such as food insecurity and parental stress, and mental health and IPV exposure. And so this was the study was conducted in 2 settings in Mpumalanga province in South Africa, which is on the eastern side, and has been characterized by underinvestment. So only about 11% of young adults have full-time employment within 3 months prior to the study, for example. So there's a lot of economic insecurity and a lot of food insecurity as well in this context. So just noting that there were 2 waves now it's about 15 years ago, to 2010, 2011. And so just that the data from those 2 waves was averaged to provide estimates of children's parenting experiences, and then also mental health, self-reported mental health or mental distress. And so there was 549 young adult women, and these were women who were in the study at waves 1 and 2, and then also reported that they were caring for a child aged 0 to 17 at wave 3. I used confirmatory factor analysis to look at the dimensions of parenting, and then structural equation modeling to map the pathways or relationships. And just noting, we noted some of the measures around parenting. So some of the measures were a bit more limited in waves 1 to 2, so we don't have the option to do all 8 dimensions that we found at wave 3. And so I'm just noting that now is a limitation. And we looked at, so in terms of mental health, we looked at anxiety, depression, post-traumatic stress, and suicidality symptoms. And for intimate partner violence, looked at past year reports of intimate partner violence exposure using the WHO measure, which comes from the conflict tactics scale. And then we looked at recent food insecurity, so within the past 4 weeks preceding the wave 3 interview, or like adulthood interview, and recent parental stress, so that was parental stress at the time of the survey in wave 3. And so I will go through this very quickly, but just noting that a lot of parenting research, especially in lower middle income contexts or in contexts of conflict or displacement, often frames parenting as either positive or negative. And what we found was actually that there's 8 different dimensions of parenting in this sample. And so that there's a range of different behaviors that then should be considered, right? If we're thinking about parenting interventions, it's not just about telling or teaching parents, nonviolent ways of disciplining their children, but also that there's things around like social support, around how to play with children or engaging in activities with children and things like that. And so I'll just note here, exposure could be phrased as exploration, so allowing a child to interact with the environment outside the home or engaging them as well in chores or things that might help teach them skills inside the home. And so what we found, just looking at waves 1 and 2, was that children who received more praise from their parents across the board had lower symptoms of mental distress. So across depression, anxiety, post-traumatic stress, and suicidal ideation, that receiving praise was protective for all of these things. In contrast to this, we found that exposure specifically to psychological abuse was associated with worse symptoms across all of these 4 different kinds of mental health disorders. And so noting we did find a correlation between psychological and physical abuse, but we did not see actually a direct association between physical abuse in the sample and mental health symptoms. So that just to know that there was a particularly strong impact of psychological violence specifically. We did see a marginal association between physical abuse exposure and anxiety symptoms. And so one thing to note as well was that we didn't see a direct association between mental health in adolescence and intimate partner violence exposure in adulthood, which will become important in a couple of slides. But what we did see was in terms of thinking about childhood parenting experience and then adulthood use of parenting strategies was that children who'd experienced physical abuse from caregivers, that about 12 years later, they were less likely to use nonviolent discipline strategies with children. So nonviolent discipline strategies are things like explaining why behaviors are wrong or taking away privileges. In some cases, things like timeout, depending on the child's age. And so those are all strategies that might be used to discipline or to reprimand, but don't involve use of abuse or violence. And then we also found that children who'd experienced physical abuse were more likely to have more rigid behaviors with children, so to be inflexible with their children. And a way of thinking about this is a lot of people may adhere to the phrase like, spare the rod, spoil the child is sometimes what's said in the States. And so it's sometimes an idea that you have to be really strict with children in order to raise them. So we found that children who'd experienced physical abuse were more likely to behave in ways that demonstrated that kind of strictness. And so we did not see a direct association between psychological abuse exposure in childhood and use of harmful or violent discipline strategies in adulthood, but we did see an indirect relationship. And so what we found was that children who'd experienced psychological abuse were more likely both to experience any lifetime IPV victimization and also IPV in the year prior to the study, the Wave 3 study. And if people who'd experienced IPV, that they were more likely than to have experienced past month food insecurity, and people who'd experienced past month food insecurity were more likely to have experienced recent parental stress. And it was actually that cascade and that result parental stress that was associated with greater use of violent discipline methods. We did not see a direct association between physical abuse exposure and use of violent discipline in adulthood. So noting that this pathway was specifically for psychological violence. And we did also see a marginal association between past year IPV experience and then parental stress as well. And so how might we stop this? So I just, we talked a bit about, how does political conflict affect violence exposure in the home, both IPV and violence against children. We talked about looking at it conceptually from the research and then looking at some of the findings on overlap, and then looking at longitudinally at what it also means for things like parenting. And so now I'm going to present a few perceptions from Colombia and then RCT findings from DRC. And so in Colombia, this was just the third question. So what strategies, including coping mechanisms, might help to reduce household violence and to strengthen families? And so in the research, we found 4 major themes. So one was around parenting and communication to improve family relationships. Another was around economic strengthening. A third was around substance use awareness and intervention that didn't come up as often as the others, so I won't present it today. The last one was around social support networks, especially to fill resource gaps in contexts where there was economic precarity. And so one thing we wanted to note was that parenting was seen as a potential solution, not just for children, but also across the life course, and that it was seen as a potential area to intervene or to interrupt violence that might be occurring. And so in this quote specifically, this was an adult woman who was talking about her adult child or adult daughter's experience of intimate partner violence, and herself going and intervening and talking it out with him, and specifically challenging some of the norms that I said before were associated with use of violence, like men's dominance over women, or violent masculinity's ability to use violence to correct women's behavior. And so we found in some cases that that adults would get involved if their children were experiencing violence, but also that there was a desire for parenting solutions or support with parenting or parenting children. We also saw 2 things when it came to economic strengthening. So one was a need for income generation training and opportunities to adapt to a more urban context. And so we also saw this in DRC and Myanmar. There was an interest and a desire to have skill building to enable this, or to enable people to obtain jobs in the environment they were living in. And so this quote reflects a shift in norms as well. So just noting that before, this woman who was in Soacha, that she did not work, and that he was the one, or her husband before was the one who'd worked, but then when she was displaced, that actually she ended up being a single parent. And so she had to figure out how to work. And so also just showing that, empowerment of women, but also not waiting for solutions. So she went and figured it out herself in terms of how she might be able to obtain a job and obtain an income, and did this actually without support from any NGOs. And so we also saw a desire for opportunities to retain previous forms of income. So particularly in Colombia, especially among men, there was a desire to have local and federal policies and programs that would allow them to purchase land. And so noting that because a lot of people had been farming, or they'd owned their own land beforehand and then had been displaced from it, that they were wanting to be able to rebuild, right? And rebuild not just in terms of farming, but also being able to have their own place again. And so the quote is, it's like saying we're going to touch the sky with our hands. It's difficult, right? And so that was in reference to actually trying to purchase land in the new place, especially in the context of economic precarities. People felt like it was very impossible to do, especially in urban settings, and that they actually wouldn't be able to do it without any government support. So the last one was around social networks. So noting that these were critical, both for finding income generation opportunities, but also for meeting material and supervision needs of the household. So people who were who moved were able to find new networks and to make friendships with, for example, neighbors, other people within their community. And what this quote is saying is, essentially the reciprocal relationship where this adult man describes that, in contexts where sometimes he may not have electricity or someone else may not have electricity, that they may be able to go to each other's homes and then charge things, but also that they could, that if they needed babysitting or other things like that, then they were relying on neighbors. So it showed that in a way people were able to rebuild networks, right? And able to build systems where they could obtain support from each other and also give support, and also noting that this was outside the context of NGO support. And so what we did in DRC and in Myanmar, but these findings are from DRC, was specifically look at or develop and implement a intervention that sought to holistically prevent family violence. So looking at both intimate partner violence and violence against children. And I'm going to briefly note the logic model was that their changes in knowledge and attitudes would lead to changes in behaviors, which would lead to improved family functioning and prevention of violence. And that the structure of the program was that there were separate sessions for women and men, and then some whole family sessions. So there was more sessions for men, in part to dig a bit deeper into unpacking some of the gender norms and perceptions, in addition to violence against children. And for women, there were fewer sessions because it was anticipated that they would not need as much time to dig into the gender norms and perceptions. And what we found was that there was a reduction in IPV exposure. So this was women self-reported exposure. There were 394 women and men, and so about 202 couples, 202 couples that had participated in this study. And so there was a 77% reduction in any IPV exposure in the last 3 months, and we found big exposures across all forms of IPV measured. We also saw a reduction in violence against children, but we specifically saw a significant reduction for female caregivers. And so noting that we didn't see a significant reduction in men's self-reported perpetration over the time period. And part of that might be that in a subsequent analysis, we found actually that reporting of that men were not using violence as frequently as women were. And part of that may be due to some of the gendered norms in the context, which make women primarily responsible for children's behavior and upbringing. And so that they're often seen as a first disciplinarian, and that essentially fathers only get involved after a certain point in terms of in terms of discipline. And so just noting that we looked at also co-occurring violence, and we found a significant reduction in co-occurring violence as well among participants who participated in the intervention as compared to controls. So just noting that there's a baseline and end line on this graph, but there were huge reductions in co-occurrence reported by both women and men. And so I did a subsequent analysis looking at what works for whom. So then looking at patterns of family violence at baseline. And so what we found was these results are for women, but among women, there were 4 groups. So there was a group 4 had high intensity intimate partner violence and violence against children, which was characterized by high frequency of sexual, physical, and emotional abuse, alongside high frequency of perpetration of violence against children. And then the low or no or low IPV and violence against children group, that was one where there was very little violence reported or no violence reported at baseline. The 2 groups in the middle, what we found was a dose-response relationship between women's emotional IPV experience and then their use of violence. So women who experienced emotional IPV, it was particularly insults and humiliation at lower frequencies, that they were more likely to perpetrate violence against children, but that if they experience it at high frequency or emotional IPV at high frequency, that then there was a greater likelihood of perpetration. And we also just want to note that 2 of these 4 groups were characterized primarily by emotional IPV alongside violence against children. And so just from a measurement standpoint, a lot of the time emotional IPV is not measured or reported when looking at interventions or outcomes. But this shows that if we're thinking about co-occurring violence, that it's particularly important to do that. But what we found was that the intervention seemed to be most effective for people or for families in which there had been lower levels of violence at baseline. So in a way, it's a primary prevention intervention, which is what it was designed to be. But what it means is that we do need different strategies then for families in which there's more systematic forms of violence that are co-occurring, that this kind of prevention intervention may not help them as much. And so we may need to think about other strategies. And so I think that is, yes, that is it. And I can go back to here, just so you can see this, but glad to take any questions.
Thank you so much, Khudejha, for that data-packed presentation and for sharing with us your findings. That was very interesting, and I appreciate, the journey that you took us through the different research that you have done and put together. We have around 12 minutes for Q&A, so I'm happy if colleagues want to raise their hand if they want to ask any questions. But in the meantime, that you colleagues gather your thoughts and you want to ask questions or provide comments. Khudejha, I wanted to ask you, across all the different settings that you have done this research over this period of time, because I know that this has not only been recently, but gather a body of work that you have put together. I think if you can think about the cross-regional learnings, considering the different contexts, what would be like maybe the main or one or two points that you will take in terms of learnings that we can take from this comparative overview that you have provided? And for who will be that learning? Will be for us as academics, or will be for policymakers? So if you can reflect on that a little bit, will be great.
Yeah, I think, there's a need to really work upstream, right, to prevent violence, because we see that there can be long-term impacts, and that those impacts it's not just on the direct violence, but it's also contextually on development as well, and the opportunities that are created or are absent for people after political conflict. And so when we think about rebuilding, right, and what that means is there really needs to be investment in that, but also if we're preventing political violence from occurring in the first place and really working upstream, right, that actually it can have a massive impact positively for women and children to not have exposure to this violence. I think another piece was across contexts is the level of economic precarity was so high, and there weren't a lot of options. And in some contexts, particularly if people were internally displaced, and in an urban context, they may be able to find a different pathway forward. But some of that depended as well on the gender norms and the contextual empowerment of women in the space. So in contexts where, for example, it wasn't as stigmatized for women to be divorced or for women to be single mothers, it was easier for them to go and obtain independent income or find ways to support their families. But in contexts where some of those norms are really entrenched and divorce is heavily stigmatized, that wasn't necessarily the case. Another piece was just around the absence of mental health support. So both in South Africa has actually quite robust child protection system, for example, but there aren't a lot of mental health resources. And in these other contexts as well, there's very limited space for mental health support. And in Colombia in particular, it was very clear that people needed that space and support, and even to discuss the impact of the conflict on their lives, and to have a space to process it. And so investing in that, I think, would be really important. And also just for, if we think about IPV and think about that trajectory with parenting, is providing support in that sense too to survivors, both of political conflict and of IPV and violence against children, can help interrupt some of these trajectories.
Thank you for that reflection, Khudejha. Any other questions from colleagues? Please make sure that you can raise your hand or you can put in the chat. Khudejha, I had one more question from me, just that colleagues are thinking about it. How is all this shaping your future research agenda, Khudejha? What do you want to do next? What is aspiration from here?
Yeah, so I think some of the next steps are is thinking about repair, right? And so there's, I think in terms of prevention, right, and thinking about intergenerational harm and trauma is what reparation should look like, and how it might need to consider, not just, a lot of the time it's limited to conflict-related sexual violence, but what we're seeing is quite a lot of psychological harm and impact, and though that often isn't considered in the legal sphere when we think about official processes of repair. So if we were going to address this and in a way where we don't see replication of violence, like what should that look like? And that's what I'm hoping to work on more.
Thank you for that. Daniel? Thank you, Khudejha.
I have to figure out how to turn my camera on. Hi, Khudejha. Thanks for that. That was great talk. I'm going to go sideways a little. In talking about some of the people, you talked about essentially a lack of capacity to engage in reciprocity and bring things into a household, particularly around disability. And yet the interventions that you look at are very much around social interaction. And I wondered if you'd looked at all at that kind of David Graeber's values notions and how one brings value into a relationship and whether that had a relationship.
Yeah, so a lot of intimate partner violence prevention work seeks to build healthy relationships. So, specifically focusing on things like better communication, different ways of talking about things, but it doesn't always touch deeply on what we consider to be valuable in a way that it might need to. And so, what I found in I didn't present it, but in Ethiopia, for example, we often think of women's like sole economic decision making as a form of empowerment, but actually women who are making these decisions by themselves and in the data, they had greater risk of co-occurring violence. And so in a way it was a reflection of, maybe a lack of, right, like shared decision making or something that actually might be healthy. And so in that sense, I think we, in terms of thinking about what it is, I'm hoping to do that in a future project of looking deeply at like when we're saying, even thinking about repair and challenging dehumanization, right? Is what does it mean to be valued and how do we show value towards people? But yeah, there's quite a lot of, I think there's quite a lot of gaps to date, specifically when it comes to disability. And there's been some recent research around looking at prevalence and trying to establish like prevalence of abuse in humanitarian contexts. But there's been some really small, I think there's been a few organizations that have done some programs or programming work that creates job opportunities and things, but it's like rooted in economic, right? Like addressing the economic insecurity and not the perception of people with disabilities.
Thank you.
Thank you so much. Any other questions from colleagues? Anyone else has any last question for Khudejha or comments? Esther, I saw that you unmute yourself. Please come in. Thank you, Esther.
Hi, Khudejha. Thank you so much for that wonderful presentation. I was just wondering if you were able to look at, the variations between rural and urban settings and how the violence, in terms of intensity, how was it? And I'm asking this because I'm hoping that, with urbanization and the availability of resources, that, violence will be reduced among some settings. And I'm just wondering if you were able to do that in any of your studies. And my second one would be, what aren't we doing right as stakeholders, as researchers, as policymakers? Why aren't we getting, a head in terms of minimizing violence against, girls and women, but also some men, as we saw during the COVID-19 pandemic? Thank you.
Yeah, those are great questions. So on the first one, there were some rural-urban differences, and sometimes not in the direction we'd expect. And so in Afar, in Ethiopia, one of the regions included was the Afar region, which is exclusively rural and is known for having higher rates of child marriage, for example. But actually, some of the reporting around violence was quite a bit lower than the other contexts, which were a bit more urban. And so that was a bit of an unexpected finding, and part of that could be due in a way to underreporting. But also part of it could be due to other things, like if people are spending long hours outside the home, for example, it also minimizes, right? Like it reduces the amount of time someone might be exposed to violence. So there could be pieces around that. We did see in South Africa some small differences. The two contexts, one is a bit more rural. And so I think we did see higher prevalence of co-occurring violence in the rural setting as compared to the urban setting. And it did seem, especially in South Africa, that the availability of resources and jobs is really dependent on context. So there's a lot more jobs in the cities than there are in these two settings that we looked at. In terms of what we're not getting right, that's a tough. So I think challenging. I think there's been some headway around parenting, right? Like around thinking about children and thinking about ways to guide children. And so there's been an increased interest, I think, in several countries around thinking about parenting and ways to support it. I think we have a harder time sometimes with the gender inequality piece because it's such a deeply ingrained thing that we learn from, we learn it from the point that we're born, actually. And they find that children as young as, I think, 2 can start to identify gender norms. And so I think combining, positive, sort of combining some empowerment interventions, but also with addressing some of the root causes around like the economic insecurities, right, and discrimination that leaves particular groups more vulnerable. Like I think we need to get at an intersectional lens and really start with that, because we have greater potential. It's, I think, tricky because there's often backlash against it, right? And so in the sense of people perceive people to be getting benefits or things like that, or somehow, somehow being benefited, rather than understanding that it's an attempt to close like a prior gap, right, that existed. So I think maybe reframing around that also is important. But it's a really big question. I think I do think like rethinking feminist foreign policy also might be important. Just like when we talk about how we prevent violence on the macro scale, like how do we really do that, I think is something we should consider. And also, where do we financially invest across societies? Because I think we often see quite a lot of investment in war, right, in tools of war, and not as much investment in health or in education or in other things that actually help people in their day-to-day lives, like live a more secure and safe life.
And today, more than ever, we see that shifted in terms of resources and finances, for sure, Khudejha. Bang on 3 p.m. We just want to thank you, Khudejha. Thank you so much for sharing your fascinating research and your time with us. And it was lovely to have you in IGHD as well. And we want to keep knowing about your work, and also hopefully colleagues can get in touch with you if you identify any potential areas of working together. But please do let us know. And if you're happy to share any publications from this work, that would be great. We can distribute it around.
Glad to do that, and thanks so much for having me.
Well, thanks,
you for joining us. That was great.
Thank you, Khudejha. Thank you so much. Thank you, everybody. Have a nice afternoon. Thank you. Bye-bye. Thank you, Khudejha. It was so good to have you. Thank you.